Oh, okay. So we're going to start this new thing on forbidden subjects. Okay,
Hmm.
stuff that you can't really talk about, like what cancer is, where comes from, how to correct it, autoimmune diseases, all this stuff. That's dangerous subjects.
Oh,
Hmm.
so
So
is
it's going to be fun.
okay. So you're going to be doing it where?
Oh, online. Yeah,
Well, I know,
we're
but
gonna
I
be
mean,
posting it on the Dr. B VIP and the Adaptive Physiology site. And then we're gonna put little snippets on what we can say on the social media world.
oh, okay. So when let's later in this meeting talk about your Dr. VIP site when there's more people here because I think more people should join because
Cool.
it's a great website. All right. So I do have a series of questions for you, and I want to start out with this. In a recent video with your son Michael, you talked about having been a contractor and how that helped you master your art as a chiropractor using critical thinking. So I'd like you to expand on that and talk about the importance of critical thinking for every person when it comes to their own health and not just to choose a guru or a doctor and do everything they say or expect them to fix them.
The biggest thing when and I was a contractor, I got licensed in 1979. Okay. And I was a contractor until 1991, actually 93, because I got hit by a car in 91. And when you're doing anything, any kind of engineering work, any kind of construction, you come up with problems. And basically, there's nobody to turn to. Okay, so you have to figure out what the heck the thing is. You know the end result, and and you got to figure out the processes to get there. Well, when
Mhm.
I started in chiropractic, I knew nothing about the human body. Okay, I knew what my chiropractor had told me, and it sounded really cool. But when I got to human dissection, because otherwise, just learning from the books, it was just like memorization. And median nerve comes off of this, and it was just words on a paper. When I got to the human dissection, it was like a freaking light bulb went on. It made all the sense in the world. And since I was older, I was 32 when I was starting. When somebody would say, "Well, arthritis happens because of old age,"
Yeah.
and I'd have an 80-year-old cadaver I could look at with no arthritis, and I could see a 30-year-old cadaver with a shitload of arthritis. So then I started to do research because when I was at the school, I had literally no money. Okay, no money at all. I got into college when I was 16, so I had a whole bunch of college credits. And when I was 19, I got licensed as a contractor, but I dropped out of school, so I had to pay for everything the first year through cash. So I ended up having to work for the library. I worked for the audiovisual department. I worked for the maintenance department. I worked for the tutoring department. So I worked for every department of the college. And so I had to teach because when you're in school, there's an equal failure rate in medical school and chiropractic. So everybody, when you're taking a class, you want to only find out what's on the next test. So I ended up tutoring every class that I had passed, which, I couldn't fail any classes, otherwise I would have been kicked out. So I got a way to explain it multiple times. But when you're looking at the practical nature of the human body, it's brilliant in its design. And so when a doctor would say, well, this is high blood pressure, or this is inflammatory bowel disease, or this or that. And I'd say, okay, cool, that's a label, but what's actually happening in the body? And they wouldn't be able to answer. They just say idiopathic, which means unknown, or autoimmune, which means the body attacks itself, which never happens. Okay, they'd be saying all of these things. And I keep on saying, well, what's the mechanism? How is the body responding? And the more and more and more you look into it, the body's intelligent. And when a doctor approaches a person with a health condition or with no health condition, okay, they go into it with certain prejudices. Oh, you have fibromyalgia. I can see that label on your forehead, so I know the therapies required for it. You have inflammatory bowel disease. I know exactly the therapies that are required. And this is bullpucky because everybody with that diagnosis doesn't have the same history. They don't have the same adaptive response. And this is why in ancient healing cultures, and I'm talking like Ayurvedic, chiropractic, acupuncture, homeopathic therapies, none of these guys diagnose. They treat each person as an individual. And this is one of the toughest things I got to untrain my doctors for. That you got to look at each person and not approach them with a prejudice based on the label of a diagnosis, because a diagnosis is stupid. The diagnosis protocol is only put in place because their therapies are so freaking dangerous. It's like the one of the leading causes of kidney disease is aspirin. One of the leading causes of stroke is aspirin. So if you suspect that guy's got a cardiovascular disease or issue and you give them an aspirin and they end up developing kidney disease or a stroke, it's okay. You did it appropriate to the diagnosis. And so the critical thinking and understanding that the body is always adapting, and nobody teaches this except some of the masters that thank God I had as teachers. Oh my God. Because these guys would work on every condition. And we had the young doctors saying, well, yeah, this is what this condition does. And the old guys are saying, no, man, there's this life force energy, and each person is going to adapt as best they can. And so when a doctor approaches a person who's in this world and they've been exposed to different physical stressors, different chemical stressors, different emotional stressors, you find out that every dis-ease, and this is how the masters used to write it, which is a lack of ease, is really the body adapting to one of those stressors. And that's
Mm-hmm.
mind blowing.
And don't forget about the part about the importance of critical thinking for every person when it comes to their health and not just expecting someone to fix them. I want you to talk about that.
Darling, that's the quality of questions that you ask. It is directly going to affect the quality of life you have. If you own a label, okay, and when you ask the healthcare professional, which drives me crazy because they're not really professions in health, what caused it, doctor? And if they say we just don't know,
Yeah.
or it's idiopathic, which means root word idiot, find another doctor who does know. You know, you wouldn't treat your car like that. You know, we just don't know what's wrong with the engine. We just know it has smoky pipe syndrome. You know,
Yeah, or they blame your genes.
genes. Oh yeah, that's good. Okay, in genes, there's a whole different world between genetic and genetic expression. The whole Human Genome Project, run by the pharmaceutical industry, was a complete failure because they figured since the human body produces 100,000 genes, or 100,000 proteins, they figured there'd be 100,000 genes. And it turns out the humans got no more genes than a fruit fly, okay, just about the same number. And so there's a control above the genes. So the Epigenome Project found out there's about 500,000 different factors that are going to affect gene expression. So every human being can express the genes to reverse a disease process, and every human being can express those genes to start a disease process. Because just the way species are, you pass on stuff that helps your species survive.
Right. And so then things like positive affirmations would affect that too, right?
Physical, chemical, emotional. Emotional, and the evidence of this is clear. Okay, how many times have you seen those yogi guys? They meditate and they could raise or lower their blood pressure. You master your emotions, you can literally change your physiology. In fact, that's what I was speaking about last weekend at a conference with doctors, and how to activate areas of your brain, because there's, you figure that the immune system, or how your body's responding, is controlled by the central nervous system. And the limbic system is a series of structures in the brain that are based on emotions. And this is so I went over how the body, how you can think yourself healthy and think yourself sick. And we're all on a three-legged stool: physical, chemical, emotional. You have to address all three of those, otherwise, you cannot achieve. And so I went through the mechanism of how the limbic system, or your perception of the environment and past thoughts, are directly connected to the hypothalamus. And the hypothalamus is a little structure in the brain that has one foot in the nervous system and one in the endocrine system. So you have a chemical communication system called the endocrine, you got the electrical called the nervous system, and based on the input in your perception, it changes your response to the environment. So you can strengthen or weaken your immune system. You can, help digestion or shut it down so you can get away from the danger, and so literally through this mechanism is how you can control, and you can control your emotions. I mean, Angie, remember when you and me grew up? Sticks and stones can break my bones, but words can never hurt me.
Yeah.
Yeah, not now. I need a safe space. No, there ain't none. It's all based on your perception.
Yeah, that's true. So, speaking of not expecting anyone to fix us, I think that we all have to be participants in our own healing. And some of the members in the group were asking if you could share some exercises that could prepare us for chiropractic care and to do in between appointments. And I have posted a lot of your exercises in my group, but they got deleted too. But
You rebel. That's
so
one
I'm
of the
gonna
reasons
make
I love you.
so I'm gonna make a page on my own website with all of these different exercises for shoulders and knees and necks and everything. But I think that maybe we could show or talk about a couple
Okay,
of exercises each time we meet. And today I want to do the neck ones. It's
excellent.
one of
Oh
my
my God.
favorite. I have this
Yep.
that I work with,
Hmm.
and I know that you've told me more than once that I'm doing it right, so I'm going to demonstrate it. But I'm going to ask you a couple questions about it too. But just up to the ceiling, back down, and keeping the shoulders straight
Yep.
and not
And
leaning back into it.
yep, yep, yep.
But you've
Now,
said keep your
uh,
arms down.
yep, yep.
I tend to, I always want to have it up here. I feel more, I don't know why.
I know girls are more aggressive. And if I say pull
It
down
does
with two,
feel more, I feel it more or something. I don't know. Is it
I
really
know,
better to have it down?
darling, three sisters, a mom, and my wife, girls are more aggressive. If I say pull down with 2 pounds of pressure, five's got to be better.
Yeah, only that I didn't mention that 2 pounds of
Okay.
pressure. So can you tell us exactly like how that helps? Like what does it do,
Mm,
the benefits? And then there's
It's,
the other one that you've shown with your, I don't know this one as well. I've only seen you do it on
yeah.
like
y-
that.
Yep.
So you said people can, like kids will lay on their stomach and do it, or you can lean forward on your desk and do it. And what's the difference between them as far as benefit? And if I'm doing this one, should I be doing the other one as well, or is just one or the other fine? And yeah.
Well, first, let's look at why you're doing it.
Hmm.
Okay. So when you look at the neck, the curve in the neck is literally called the arc of life. But why? Well, for one, the brain doesn't stop at the skull. There's an oblong section that extends the top portion of the neck, and this is called the brain stem, and it's where all the cranial nerves, or half the cranial nerves, are. And
Hmm.
this is also the cardiac and respiratory center. So this top part of the neck controls heart and lung function. That's kind of important. A little bit down below, C3, C4, C5 keeps you alive. That's the mnemonic I would teach people, because C3, the third cervical, C4, and C5, that's where the nerve to the diaphragm comes out of. And that controls lung function. And lung function is one of your detox pathways. So you got the brain stem and then you got the lung function. Oh, and the vagus nerve? No, baby, what happens in Vegas doesn't stay in Vegas. I'm talking the nerve that comes out. It's the 10th cranial nerve that extends in the top of the neck that controls all the digestion. And that's where neurotransmitters are produced. So this is brain function and immune system is in the neck. Okay, wait, don't buy yet, folks. When you get below that from C5 on down to C8, okay, and you're going to say there's only seven cervical nerves. Yeah, there's seven cervical bones, but there's eight cervical nerves. So that's all the nerves that supply the arm. Okay, and this is every carpal tunnel, golfer's elbow, tennis elbow, rotator cuff issues. All of these things are in the neck. Okay, so that's kind of important, right? We're talking breathing, immune system, brain function, everything is in the neck. Now, what's the most common thing is with modern society, we're seeing a loss of curve in the neck because this has to do with driving, it has to do with typing, it has to do with, looking at this, okay, the cell phone. Okay, loss of curve in the neck plus sports injuries, little traffic accidents. So getting that curve in the neck is essential. Now, one of the things, and this is why you're pulling down, okay, because people will literally move their neck like this. Honest to goodness, Angie, people will come in and say, gee, doc, my neck hurt like heck this weekend, but it doesn't hurt at all now. Yeah, because you're not freaking moving it. So, typically if it hurts, you're not going to move it. So, what that does, it pulls down and it somewhat isolates the neck. But now, and so you could use a t shirt, you could use anything. But to not even use that, I'm going to give another exercise that's absolutely fantastic. But you got to understand the curve in the neck is what we want. Now, the joints in the neck, the discs, have a horrible blood supply. They get most of their nutrients through a process called imbibition, which is movement. So if you don't move those discs, like if you have chronic tight muscles, those discs get compressed. And then because it gets compressed, it becomes unstable. Then the body lengthens the bone. It literally remodels the bone in order to stabilize the ligament. So that's called arthritis, which is a BS term because arth means joint, itis means inflammation. And the number one arthritis that we see in the neck is called osteoarthritis, which is a non inflammatory joint inflammation. I know you can't smoke enough weed to have that make sense. Osteoarthritis is a non inflammatory joint condition, but it's in the joint inflammatory category. It's also called degenerative disc disease or degenerative joint disease. Here's a news flash: it ain't a disease, it's from a trauma.
Well, I
Okay.
knew this exercise was good, but all that stuff you said now, it just makes me, it'll
Yeah.
make me make sure I do it all the time. And you recommend when people are sitting at a desk to do it 20 times every hour, otherwise
Yep.
at least 100 times a day. And I think Dr. Blanco told me when I said, well, what's the max we can do? I think he said a couple hundred would be
Yep.
about enough. Like you shouldn't
Yep.
really try to do more than that, right?
I
Look at
had
Kelly, she's doing it. Can you see her up there? Kelly's
yep, yep,
doing it.
yep. And,
Don't
and
turn
I
your head sideways.
oh no, no, no. I'm gonna show you another one that's a little bit more advanced.
Okay.
This one's safe for even people that have had surgery, and we'll get some people that have literally every plate in their neck and only the top two bones are moving. So, if you have surgery or anything in the neck, you have cervical fusion, okay, don't do this one. This one's going to be more advanced. But what we want to do, the worst thing to do if you have loss of curve in the neck, and you could even try this. So if you sit up, put your chin up, and you could turn your head to one side, turn your head to the other side, and you can see how far you can turn. Okay, so just try that. Okay.
Mhm.
I had to get a nice range of motion. You must have a chiropractor that loves you. Okay, so now put your head really far forward, as far forward as you can.
Just my head.
Just your
Okay.
chin as far forward. Now try and turn it. Doesn't
I've
work as
heard
well, does
stuff
it?
going on.
Yeah, it
I hear
doesn't
crunching.
doesn't work as well. And the crunching that you're hearing is pressure building up and pressure releasing in the joints because all the joints are hydraulic. And if they move correctly, then they fill up with fluid and that crunching doesn't go away. Okay,
Hmm.
or it'll go away once those joints are full of fluid. So now here's the exercise. 3 times, 3 seconds each one. So the first one, you're going to point your chin to the ceiling and force it up and hold it for 3 seconds. 2, 3, and then look straight ahead. Then 1, 2, 3, and think of more stretching like this. So just like you demonstrated, you don't want to go back. You want to go up. 1, 2, 3. So you're forcing that curve in. Then you keep your nose level and turn your head as far as you can. 1, 2, 3, and then 1, 2, 3, and then do this 3 times. Oh God, that feels so damn good.
It does.
Okay. And then go back to the middle. Okay. Then put your ear down to your shoulder. 1, 2, 3. 1, 2, 3. And I want you to force it down to the shoulder. 1, 2, 3. One,
Uh,
2, 3. And don't cheat by lifting your shoulder.
I did.
Everybody does because you want to be successful. I know. It sucks to do something that you're not good at. The worst thing that you can do if you have loss of curve in the neck is the coupling motion that they do at most yoga studios, where you're moving your head in a circle.
Oh.
Okay. Because the way the joints are in the neck, the way the structure is, it's designed to bend, it's designed to turn, and it's designed to laterally flex.
Hmm.
And I want you to own this one, when there's a loss of curve in the neck, it's hard to get those range of motions. So
Yeah.
if you have a loss of curve in the neck and you do that beautiful, uh, I mean, it's a sexy friggin' head movement where the head moves in a circle, it's going to do damage. So this one, unless you've had cervical fusion at the bottom, is safe and easy. But that, hold it for 3 seconds, and just for fun, you're going to see that you're going to be on the third one. You're going to be moving a heck of a lot further than the first one. So you're literally filling those discs up with fluid.
Okay, you know what? That raises other questions in my mind about other exercises I've learned just from watching chiropractors or physiotherapists online, or even past chiropractors. And now I'm a little afraid to do some of these things because I've shown you one or two before, and you said, no, don't do that. And one of them was one chiropractor taught me to like hold the forehead and then push, push, push
Oh
forward,
hell
and then
no!
see.
Yeah,
So
yeah.
I've
There's
not been
no.
doing anything other than what you say because I don't know the. And then another one had me holding like this. Oh, he said turn like this and see how far you can look, and then was it this way?
Oh
Push,
yeah.
push, push.
Ah.
No. Oh boy. And that's
Oh,
this
oh
guy was a chiropractor in my town for 30 years. He was the head of the chiropractic society and everything.
Yeah, when you look at a lot of it, and I literally had one of my doctors that was taught about tucking the chin and pulling the neck back. Okay, so and I said that's going to destroy and reverse the curve in the neck, which is the exact opposite of what you need to do. Okay, I've never seen a patient that tucking the chin and pulling the chin back would be a good thing. So I literally said, okay, let me take an x ray of you. Okay. Now put your chin in the position that you think is beneficial. Then I took another x ray and I said, dude, look. it's, it's like crazy because you have old school, okay, which is what the masters taught me. The nervous system controls everything. We got to release the interference of that nervous system, and the natural curves of the body are important. Now,
Hmm.
Angie, don't say duh. Okay. Then you have the other group that says, oh, stretch that tight muscles. If it's tight, stretch it out. No, that's foolishness. So all of these things are to work with the muscle, okay, without understanding why the muscle is tight. And this is why, when you first said, the quality of your life, okay, I mean, the questions that you're asking are directly going to affect your health. So, why is the muscle tight? Now, you've got muscles, okay, because all of these are muscle work, okay? You've got muscles that run from the base of the skull down either side of your spine down to the sacrum. And these are called postural muscles. Now they
Mhm.
aren't under conscious control. Like these muscles you can tighten, you can loosen. Okay? Yeah, I got good conscious control of these. Those you cannot tighten. They tighten under proprioception or your brain's view of your body in space. So if you knew that that ear is supposed to be in a line, and for every 1 inch they head forward, the pressure on the disc double. And so if your head is forward, that's going to trigger these muscles to pull it back. And this is why people will be stretching their neck, stretching their neck, stretching their neck. And they'll say, gee, doc, my neck's so sore. And I'll say, well, because most doctors will tell you how to make it better. Forget that. This guy has been told this, by every physical therapist, by every occupational therapist, by every medical doctor. You got a tight muscle, stretch it. Okay. And that's foolish if you don't know why it's tight. So I say, look, this is how you make your neck worse. Okay. You stretch it forward and stretch those muscles. And he says, no, doc, I want to make it better. Okay, good. Let's get the curve in. So just that exercise, putting your elbows on a table, lifting your chin up and relaxing your shoulders. So all the way to your head's on your thumbs here. I go in the back and I grab their neck and I say, okay, try and tighten these muscles. And they can't. I say, yeah, because you're taking away why the muscle is tight. You're not stretching a tight muscle. Why is it tight? This is why, like, when I refer one of my patients to a massage therapist, and I got a couple of brilliant massage therapists, but I'll say, do the effleurage and petrissage anywhere your little heart desires, because that's a light tissue work and that just feels good.
Mhm.
That's what you do on your cat. But no deep tissue work on this area, or this area. Because if somebody has a lateral deviation, okay, like where, they fell off a roof when they were 12, okay, or something, the muscles on the outside portion of a trauma are going to be tight. And this is why when I'm working on you, there's evidence of past trauma. You make it over a half a century on this planet, you're going to have some past traumas. And this isn't something that will bring you to a hospital. And people will, like I just had a 75-year-old gal a couple of days ago in Mexico. And I said, well, you've got grade 3 arthritis here. That means you've had a trauma for 20 years plus, and you've got good motion, so we can start to reverse that. You've got some deviations here. This evidence of trauma is only less than that, about 15 to 20 years old. And she says, I remember the one incident. And I think, no, come up with 1,000 incidents and you're 5,000 traumas short. Okay, all the traumas that we do, but that muscle on the outside of the curve is spasming to correct the problem. So you only relax the muscles and not even the muscles. That's why when we use that vibration tool, I'm relaxing the ligaments, which is the disc, so that allows me to change the position and motion and communication of that vertebral segment to the brain. Then the muscles on the outside of the curve relax because I'm fixing out why I'm fixing the problem, why they're in spasm. So you've got to know why the muscle is tight. And the only way you can do that is through either an x ray or a surface electromyography, which we do both.
Wow, that makes me, what's going on here? Um, I can't see you now.
You can't see me?
Oh, there you are. Yeah,
Oh,
so I heard it's almost like somebody else had their mic on,
oh, yeah.
which I didn't think they would or should.
Yeah, there's three, four
Okay,
people with a mic going.
okay, I can mute them. Um, that information is just kind of, I'm still processing it. It's like all these, you can find thousands of exercises online, physiotherapists and that. Now I'm afraid to do anything. I used to post a lot of those in the group. I tried and I think, well, that feels good. And then I post it. But now it really got me double like thinking
Well,
like the chiropractors give me exercises and that you're telling me are wrong. Like, why is it wrong to put like push like that? Because when he had you pushing like that, then the next you look again and now you can look further.
yeah,
That was his purpose for doing that, to get more range
mhm,
of motion in your neck. But
totally cool.
but no, you said it wasn't good.
It's not. It's not. I mean, if his method is to have you tighten up and strain and then that muscle is going to be a little bit stronger. It's kind of like if you lift a weight first, that's okay. But now you're activating that brain's control of the muscle, and you're activating these little in the tendon of every muscle. There's a thing called a GTO, a Golgi tendon organ, and so the more you move it, the better and more those actin and myosin filaments in the muscle can activate. So the first one you lift, it's called a warm up. Then you can lift more weights. And this is what every guy in the gym does. They don't go in there and they start doing 400-pound, deadlifts. They warm up so they can get that brain and the active myosin filaments going. So that's what that does. But why? Like every exercise I give you is a ligamentous based exercise. This, I'm working the ligaments. And the ligament is the disc. And then you've got all these little tiny ligaments and muscles that you're actually hydrating the disc in between the two bones. Every
Hmm.
time you're moving it, you're hydrating it. So this is filling those discs up with fluid. I give a little round white foam roll that you put generally at the bottom of the elbow is the bottom of the roll. Oh my gosh, thank you. I didn't have one for demo. Okay, you rock. Okay,
It's right here.
this ain't no pool foam roll. Okay, you cannot compress it. It's very, very
No.
firm. Yeah.
Yeah.
That is a ligamentous based exercise.
Hmm.
Okay. When you're doing the foot on a block, that's a ligamentous based exercise. When you're doing the knee dangling, I'm straining all the ligaments in the knee so they can start to regenerate. We're also creating a negative pressure so the cartilage can get fluid. So every exercise I give isn't for strength. Let's restore the structure because the spine gets its strength from the curves, not from the muscles. Okay, so you got to restore the curves, then you restore the nerve supply, then you're friggin' bulletproof.
Wow. So one last thing about the neck. After doing the first time I did the posture pump at your office, and we talked about that in the last video, but when I was done, it really felt uncomfortable. So I
Oh,
started
heck yeah.
rubbing, like squeezing, rubbing the back of my neck, and you said, "Stop! That's the worst thing you could do." Why is it the worst thing I could do?
Oh my God. Great, great. Okay. So my ears roughly in line with this. Okay, this is just what we call normal. Okay, so now I'm going to rub my neck. For every 1 inch they head forward, the pressure on the disc double. And so
Yeah.
right now I'm spasming out the muscle. So if I put my head forward and rub it, what am I doing? I'm activating all those muscles.
Okay.
So rubbing it, I'm moving my head forward. So I'm actually making the problem worse.
Yeah, but what if I look up like this kind of and rub it?
Okay. Or what if you just restore the curve, which is what the posture pump was originally supposed to do, and then you deep breathe, which increases what's called intrathecal pressure, forcing fluid in the disc. So take away why the muscle is spasming. And that's why we talk about restoring that curve to take care of the shoulder spasms. Because it's just the body is so smart. Okay. And you're looking at muscles that are governed by a whole different series. A muscle never I have never, ever seen a problem in a human being where the muscle is the problem. And but patients will continually come in and say, "Oh, I have piriformis syndrome," and the physical therapy, "I have chronic tight hip flexors." Okay, and look, well, why is it tight? No, it's just chronically tight. Okay, when you look at The pelvis, piriformis syndrome. Anytime you hear syndrome, no, the doctor is not critically thinking. That would be like ideal. Just say, dude, what's the cause of it? Well, it's piriformis syndrome. Here's a number of different cases that can cause it.
Mhm.
And no, what's causing the muscle to increase its tone? Like if you look at piriformis, this has to be it's a muscle in the pelvis. It's the only muscle that crosses the sacral iliac joint. Okay. And if the pelvis is unstable, that's going to be tight. So stabilize the pelvis, and that's the trochanter support. Then the
Mhm.
piriformis relaxes. If you got tight hip flexors, restore the lumbar curve, and you're going to relax the hip flexors generally.
Mhm.
I mean, it's and this is why, my dear, when I say you do the work, I get the credit. You're doing all the exercises.
Yeah, but you do a lot. You do a lot to help.
Oh,
I would encourage anybody to come and see you and go to the
oh yeah.
clinic.
Well, I mean,
So,
the adjustment is literally creating inflammation at the level of the joint, so the body can regenerate it. Oh yeah,
Connie's asking what this is called. I don't know.
TheraCurve. It's
Theracurve.
literally a TheraCurve, and what it is pipe insulation. Okay, in the middle of it. Yeah, that's a
Mhm.
contractor.
No wonder.
Surrounded by nylon and with a webbing strap because I used to do a lot of rock climbing, and the webbing strap is from the rock climbing, and the pipe insulation is from.
So, did you invent this?
Yeah, yeah,
Okay.
and it turned out I was going to get a patent on it back in the mid '90s,
Hmm.
but I had been distributing it so long, and I just ended up not getting a patent. I give them away to patients if they're under care because we got to get it. I give everyone it on the exam just so they can start doing it. Yeah,
Somebody said they're using a pool noodle and they put something through it in the
it it
comments
that
there.
that might be a bit thick.
Yeah, I was thinking that too. This is, you could, um,
Yeah, but before
wrap right
that, I would
around it.
tell people to bring in a dish towel. Okay,
Yeah, the
and
dish
I got to
towel is
tell you,
how.
if we yeah, that one that owner. That's the only thing that's a bit thick. Okay. A dish towel is just perfect. The problem is
Mhm.
when you say bring in a dish towel, you're going to have a variety of towels.
Yeah.
And so it's better to just grab just the a small piece. And that's why I like that pipe insulation because it's just enough to decrease the tension or spread the tension out from the straps and you're pulling it down and lifting up so you're isolating the neck, and that's all that's for, is to isolate
Or
the
just a
neck.
t-shirt or something. Like I've used different
T-shirt,
things. They
yep,
all seem to help pretty well. And we don't have to have this. You can do it fine without that, right?
yep, just the a scarf would be better without the pool noodle.
Right.
Perfect. And you only put it on the back unless you don't like them, then you put it on the front.
Well, so I wanted to ask you something, and you do that sometimes. You answered part of it already in my first question, but I was fascinated when I saw your video with Michael about when you talked about being how you basically took your accident, and it was like the universe handed you a plot twist and cracked open new paths or a new detour sign that read Cairo School this way, and you turned it into a highway for healing others because of your accident. And then all the tutoring is the part that I didn't know about, and all the rest of working in the college. That's when I realized why you basically, like I said, you didn't learn and study and pass. You internalized all of that information and you turned knowledge into wisdom. And I want people to realize that because people will see chiropractors and say, well, he's just a chiropractor. He's not a real doctor. And you're
Thank
more,
God.
yeah. Well, you are like, I mean, a real doc depends what kind of doctor you're talking about. But that to me, like, I've listened to so many of your videos. I knew you taught human anatomy and dissection and everything, but you went into more depth during that video. And I just thought everybody should know what you did because it wasn't the average. chiropractic student going through and passing and becoming a chiropractor. It was well beyond that.
Well, part of the story, and I don't know if I relayed it then because I typically don't. 2 weeks before I was hit by the car, I was putting an X-ray lab in for Dr. Mark Anthony. I think he's still in practice in La Crescenta. Brilliant guy. And I put in an X-ray, the lead sheets and stuff. I know nothing about chiropractic, and except I knew how to install an X-ray lab. And threw my back out. He adjusts me, teaches me how to work because I just strap a back brace on and just keep going. And when he adjusted me, I had this warmth go down both my legs. He talked to me for about a half an hour, showing me how the body works. And I'm looking at the structure and thinking, it's so weird because you've got legs that come in like this and go like this, and then you got curves here and here. Look at the force loading. It was just amazing. And then he told me, he says that I would be a good chiropractor. And I thought, dude, I'm 31 years old. I've got 6 employees. There's no way I got a cabinet job. I'm not going to change courses. Midstream. That's just foolishness.
Mhm.
But I was praying to God for a change. I didn't. I'm I was good at what I was doing, but I just didn't feel. It just didn't feel right.
Mhm.
And you know the old saying, God gives you what you need, not what you want. Okay.
Mhm.
And hit by the car and went through the medical establishment. Thank God they kept me alive. Thank you for emergency medicine. Okay. And, had both my legs broken, my sternum fractured, skull fractured, my heart and liver bruised. And so I tried to work and it wasn't really working. Okay. It was very, very hard to bend, turn, twist. And then I went in, had an operation on the knee. And the doctor that saved me, he says, "Yeah, it's you're going to recover. Eventually we're going to have to replace your knees." And so then they did another operation, another arthroscopic operation to clean up the joint. Oh, that's the biggest BS ever. They're not cleaning up anything. And I noticed after the first operation, my knee was unstable. After the second operation, which involved both knees, okay, it felt less stable. Then I started to think, they're not putting stuff in, they're taking stuff out. So if I'm taking stuff out of an enclosed joint, that probably is why it's unstable. Again, we're just talking common sense. Okay. And so then I went back, I did the prerequisites and started the college. And, then I found
Yeah,
out
but
that
that the part that amazed me was how you were tutoring the semester behind you. So
oh, always,
you, yeah. So
always.
that's what internalized this information. You didn't just learn and pass. You were tutoring until you knew it and doing research for questions that they asked you and all that. That's the part I loved hearing.
And then you got to say the same thing in a whole bunch of different ways so people can understand it. So we got this group of Korean students, which God bless them. I would get to the school like 3 hours before they opened, like 4:35 in the morning at Denny's, which was right next to the school. And we developed a study group because they were the only ones there. Then you had the Persian group. Then you had the other group because they all form cliques to get old tests and study groups and everything else. So I would tutor each one of those groups, and it was so much fun because to know something, the more you teach it, then you start to see the pattern of how it fits in the whole picture. And then
Hmm.
you realize that everything is connected to everything.
Yeah, that was amazing to me. And that's like I knew you were um how I say it, beyond what
Well,
a lot of other people can talk about, like chiropractors and everything. And now I know more why, because you explained that really well about your tutoring and teaching and the library work and the journal articles that you would copy and make extra copies for yourself and all that kind of thing. Or if somebody asked you a question you couldn't answer, you'd go and research it and all that. So that's just
well,
something
it, well,
I
it,
like
and
people knowing.
And still, most of the schools are laid out with memorize and regurgitate. Okay,
Yeah.
so and they're not critical thinking. We had the Japanese students come over from, I mean, literally from Japan. They have some restrictions on human dissection or something. And so normally we would take a cadaver and it would take 4 classes and about 2 months to bring that cadaver down. So we're opening up and looking at every aspect. When the Japanese students were there, we did it in 2 weeks. But it wasn't just memorize and regurgitate. It's like if you compromise the nerve here, what effects are it? This is because it goes to here, it goes to there. So when I would tutor or teach the anatomy, I'd ask these students over the cadaver, I'd say, what's the connection between the hand and the eye? And, they back up, because I want to put them on the spot. And then I would pick somebody with light colored eyes and I'd say, watch their eyes. And I pinch here really, really hard. One, two, three, bam, and I'd squeeze, and you'd see the pupils dilate. And half the students said, wow. And I said, yeah, yeah. But what just happened to the liver? Well, the liver starts to put glycogen down to glucose. So blood sugar elevates. What happened to cholesterol? It goes up. What happened to digestion? That was shut down. What happened to heart rate? That went up. What happened to blood pressure? That went up. In that instant, okay, the body adapts completely. Every system shuts down. It's like you now see the Romulans and you're switching to battle mode. you know, for any Star Trek fans. Okay, so your body instantly switches to to the fight or flight or protection mode. And
Hmm.
every human being has two switches, regeneration or stress.
Yeah. So let's look at some questions from members. Somebody's asking, and I know you're not going to be able to give an exact answer, but how long would someone need to spend with you to fix their chronic neck and back? I asked you that question when I was there. I think you said 7 years.
Oh no, well, it depends. Okay, so if you
Yeah.
want symptom relief, it's typically 8 to 10 adjustments. It's
Hmm.
usually a lot quicker than that, but because it's really based on how long it's been there, lifestyle changes. If people are taking the standard 12 to 15 medications, if you're over 60, I mean, I'm going to be 66 at my next birthday in a couple of months. Oh yeah, baby. Okay, so and I don't take any drugs, but so somebody's making up for me. But if you're doing a huge amount of drugs, okay, it may take longer. If you've had multiple COVID injections, it may take longer. But typically, 8 to 10 adjustments or less. And we do 3 adjustments a day, 3 to 4 a day. So you're looking at 3, 4 days before you get symptom relief. At
Oh,
30
I felt it
adjustments,
faster. I felt it faster. Remember, I think his name was Steven. He could hardly, he was barely walking when he came in, and after a couple adjustments, he was just doing fine. It
isn't
doesn't
that a
take
trip?
that many, and for me, I felt better after a couple too, like after the first day. But I mean, as far as like she's asking to fix the
Hmm.
chronic neck and back, and that's a different thing, right? It takes a lot longer.
Well, yeah, it's kind of like when you look at spinal surgery magazines, they say they have a 95% success rate. And their parameters on success are knocking you out and waking you up.
Hmm.
So not pain, when you look at pain relief, you're looking at a 70% failure rate within the first 5 years. So if you're looking at pain relief, you're looking at generally 3 to 4 days tops.
Hmm.
Okay. It's going to be a lot sooner. But we do post x-rays and post nerve scans, okay, within 2 weeks. And that's 3 adjustments a day, 5 days a week. At 30 adjustments, we're getting another set of x-rays in
Well,
scans.
what's
This,
happening, like when you said to me like 7 years, I think you're talking about before you're building all new discs and everything, because it takes
oh,
7 years,
oh,
right, to
yeah.
replace them basically. But you
Yeah.
also said, well, in 7 years, you're gonna still be here, right? So you might as well do the work because in 7 years you're either gonna be worse or better. You might as
Hmm.
well let your body heal. And someone's asking about childhood scoliosis of T-spine, now 55, perimenopause, and says, I feel like my spine is twisting.
Hmm.
I don't know what the question is, but I mean,
Oh, no, I know what the question is. The biggest thing, and this is where they give a common misinformation, okay, or it's disinformation. They're purposely lying to people,
mhm.
that there isn't a window of opportunity, that you have to correct this scoliosis before skeletal maturity. None of that stuff is true. Okay, and I'll run you through 70 plus year old people that have massive scoliosis recoveries. Okay, but the big thing with scoliosis is you've got to look at the normal curves. Normally the human body has a 45, 36, and a 32-degree curve in the normal structure. And from the front, we should be straight. In scoliosis, you're looking at a loss or reverse of all the curves. And the curves normally are there for shock absorbing. If you're missing the curves, the body has to develop a lateral deviation for that shock absorbing. So the way that you correct a lot of the scoliosis is to restore the front to back curves or the lordotic curves. This is why we give the foam roll, the neck curve exercise, but also, how do you tell if you can fix it? Okay, if you have a lateral bend in the spine, the only way that you could tell is to bend into the curve and then take an x ray. Now, if it doesn't change, then it's stable, it's not going to progress or digress. If it does reduce, then that's the minimal amount of correction, not maximum, minimal amount of correction. And because when you're bending, we're only seeing the limit of the structures there, like the discs, the ligaments, the muscles, and all that stuff can change. So yeah. And perimenopause in the environment we're at, get some healthy fats. Understand that the pelvis is going to be involved in the cervical spine because that's the parasympathetic, the rest, digest, and repair system. If you've had your gallbladder removed, which is common in stupid world, okay, you're going to have to massively increase your fats because you got a fat absorption. That's an issue. If you've had any medications, or because all medications slow or stop a metabolic process, there's a lot of things you can do to help perimenopause. I mean, my wife is 52, and I know exactly what that's like to help your sweetheart out through it.
Mhm.
Luckily, she sleeps with her chiropractor.
Now, Brandon's asking about exercises. We already spent quite a lot of time talking about those today, that he wants read tightness and pain that originates in the hips, lower back.
Oh,
We've talked about this one with the
yeah,
foam roller for turning sitting into therapy. That helps your lower back, right?
yeah, and also the burning sensation. Okay, that this is a major red flag that there is nerve compromise. Electrical burning, sharp, and shooting. All of those are pinched nerves. Now, insane doctors will call it neuropathy because that sounds really scary. And then they'll give a gabapentin or Neurontin or some kind of drug to reduce it, which actually makes stuff worse. Okay, so that burning pain in the mid thoracic, you for sure going to have a loss of curve in the neck, a loss of curve in the lumbar. There's also going to be some kind of structural deviation in the rib cage area. That's between the shoulders. The pelvis, there's no muscle that crosses the back half of that pelvis. And with lumbar issues, the pelvic is going to be unstable. And this is where a lot of chiropractors screw up. If they're, because the pelvis is so fun to adjust. Big old huge bone, bam, slam it in place, big pop. The patient feels good. The doc feels like he's done something. But then you get in the car, by the time you get home, your back hurts again. Okay. And that's because the pelvic instability is going to be a big issue. Now, the biggest thing with long term low back issues is to look at the foot. If the big toe's leaning towards the other ones, it means that you've got compromised nerve supply to the foot. So the gait's going to be off. And Angie, every adjustment. Do I look at the feet and knees?
Yeah.
Every adjustment. Yeah, because if we don't correct the gait, we don't correct the biomechanics, then when you go walking, you're not going to be walking symmetrically. You're going to be destabilizing that pelvis. And so we stabilize that pelvis with a trochanter support in the first 3 weeks to 3 years, depending on what kind of biomechanics we're working with on the lumbar, thoracic, and cervical spine.
Yeah, we'll have to talk more about that trochanter support next time, but I, Brandon, you should watch our first video that it's on my YouTube channel because we did talk about that there too. And Lynn talks about, can you see that one?
Yeah, yeah, yeah. Oh, that's a really, really good one. Okay. L4, L3, L4, and L5 discs pushing forward. Is there a daily stretch that I can do? This is, again, one of the most common things that people will tell me when they're coming in because they had pain. They went to a medical professional and they did an MRI and they said, yes, you have a disc bulge at L3, L4, L5. Okay, why? That's never asked. Why? Okay, because discs do not bulge randomly. But so now, what I want everybody to do, if they can, sit up nice and straight, okay, keep their shoulders level and slide off to the side. Let's just hang.
Oh
Yeah,
yeah, keep
perfect,
your
perfect.
shoulders level.
Yeah, 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 perfect, perfect. Let's just hang out here for a bit.
Okay.
Where do you feel it? Ow. Yeah.
It
So
doesn't
let's
hurt
go
me
back to
though.
normal. Go back to normal. Yeah, because that
Yeah.
sucks. Okay.
So
Yeah.
that's not good. Okay.
So that I have never, ever, ever. It's like X never marks the spot of the treasure. Okay, this never has that disc bulge. Why it's bulging, there's got to be some other area that's out. There's going to be a lateral thoracic deviation, loss of curve. 30% of low back issues is coming from the neck. But these idiot doctors, instead of identifying and saying, look, this disc bulge, it's connected to the entire body. We got to look at the entire structure to find out why there's been abnormal force loading because it is hard to bulge a disc. You're looking at the disc is composed of 80 interconnecting rings of ligament. When you're doing a human dissection, you can pass a probe that kind of looks like a pen into bone pretty easy. You can't beat it into a disc with a hammer. So to have some kind of disc issue, there has to be an abnormal force loading. You find that, then the disc can regenerate.
Wow. And she mentioned sciatica too. Is that related?
Well, that's where it comes out of partly. Yeah, but again, the this is not sciatica is again, it's a pain going down the back of the leg.
Mm-hmm.
Okay, the sciatic nerve is the diameter of your index finger, and on a cadaver, you could grab it and pick the whole body up. It feels just like an electric cord. It's amazing. Okay, but it's not the sciatic nerve, and it's not even the discs that are controlling it. Why is it happening? Are the feet off? Is there a bunion formation? Is there a loss of curve? Is there a lateral deviation? Is there forward head carriage? That 12 to 18-pound head, okay, if it's forward, you're going to have a complete abnormal force load. It's called holistic. It's basic common sense. Any doctor and this is where they're trying to dumb down the doctors. If it hurts here, look there instead of asking that critical thinking of why.
Right. So, are you there?
Yep, I'm
Oh,
here.
my screen went black, but I see you now. The next one I love because I've heard you talk about it before and people don't believe it about bone on bone. Do people have bone on bone, missing discs, compressed discs?
Hmm. Yeah, all
Talk
the
about
time.
bone on bone.
Yeah, so a person will come in, they'll walk in the room and they'll sit down. So the leg goes from straight to 90 degrees. Okay, straight to 90 degrees. And they'll say, "Yeah, my doctor says it's bone on bone." And I said, "Well, I highly doubt that. Let's take a picture." And about, a little bit more than 95% of the time, We take a picture of the knees or take a picture of the hips or, take a picture of the vertebrae because every patient, you take a static one where they're standing straight, then we take a bending film and then we bend you the other way. And if there's motion, then the disc can be regenerated. If there's any kind of movement, the film over each joint with the cartilage, meniscus, whatever the structure's in there, then that can be regenerated. And there's a law called Wolff's Law. Bone
Hmm.
is laid down where it's needed, resorb where it's not. And so the bony distortion that you see when the doctor says bone on bone, okay, that bony distortion is the body doing everything it can to stabilize. And all the joints in the body are fluid filled, they're all hydraulic. And this is why when crazy doctors say, "Oh, it hurts, put ice on it." That mechanically doesn't make sense unless there's an acute injury. If it's a
Hmm.
chronic injury and you put heat on it, you're going to rush blood to that area and fill that joint up with fluid. So the whole thing is to restore the metabolism in that area. But you can't fix a knee unless you fix the biomechanics of the foot and the calf. You can't fix a knee or a hip unless you stabilize the pelvis and correct three things you got to fix: physical, chemical, emotional stress. So you may have a joint alarm that some doctor said it's bone on bone. I'm telling you right now, I ain't never seen it. And I've worked on tens of thousands of people.
Yeah, so you've said that as long as there's some cartilage and that can then it can be regenerated, and that if it was bone on bone, they wouldn't be walking or
Yeah, and
bending.
and and also the doctors are using false data. They're using an MRI typically, and this is when typically the patient is laying down, so you got gravity pushing down, the table's pushing up, and inflammation distorts it, and body position distorts it. So
Hmm.
I can't tell you how many thousands of people come in. Yeah, I had a disc bulge and it was back when I was 18 and it's still there. Well, no, the body's changed itself a dozen, every 7 years, every cell is brand new.
Yeah.
So it's the distortion of that. That's why they went to vertical MRIs. Okay, weight bearing MRIs. And they found those totally different results than if they're laying down. And we use standing weight bearing x rays. So if we're shooting a picture of your knees, you're not laying on a freaking table. We have you standing so we can see what it looks like under a force loading. Then I can tell you, yeah, it can be regenerated. But you already
Hmm.
know because the freaking thing can bend 90 degrees.
Yeah. And she wants to know if you can get folks off their drugs. I guess it,
Oh,
yeah.
yeah. Yeah. But oh, this is one thing. This is one thing's totally cool. And Angie, if you have 1,000 people, you ask them the same question, it's going to be rare that you find the same answer. Okay. And
Hmm.
so ask everybody this, and this is people taking one drug or a dozen drugs. Because people aren't taking it because they feel vital, healthy, excited about life, fantastic. No. Let's say that you and me were left alone on a deserted island, and I'm talking to the person that's taking the drugs. You have only fresh fruit, fresh fish, fresh water, okay, fresh vegetables. You have no access to pharmaceuticals. Does your health improve or decline? What do 100% of people say? Well, well, doc, I guess I'd improve. Really? You got to guess? Okay, I guess I'd improve. I would improve. You're right. I got to browbeat these, because they're in this delusional world of chemical-based therapy, which has only been around 100 years. Okay, you got the ill, we got the pill. And that is creating the sickest industrialized nation in the world, which is America, using chemical based therapy. So first I tell them that, then I go to drugs.com and I say, these are the effects of this drug. And when you look at what the effects are, every drug causes the symptom it's designed to treat. like non-steroidal anti-inflammatories, Advil, Motrin, Aleve. Okay, Tylenol is not in that category because nobody knows the clinical pharmacology of how Tylenol works. Okay, but all of these destroy the building block of cartilage. And this is given to people with joint pain.
Hmm.
Is that dumb or dumb?
It's dumb.
Yeah, but getting people off of opioids, which is really a powerful addiction, or antidepressants, powerful addiction,
Hmm.
address the underlying causes first, and then we help them with their detox pathways. And like we do the live blood cell analysis at the clinic in Bangkok and the clinic in Tijuana. We had to remove it because of governmental restrictions out of Huntington Beach.
So you
I,
can't do it in Huntington Beach, but you're still doing it in Tijuana,
Yes, and Bangkok. So, you
and you
know,
can't give them in California anymore. Really?
nope, nope.
Wow. So that's a good reason for everybody to come on down to Tijuana. I'm planning on going on April 13th.
Yeah,
But I was thinking of coming before you went for a couple weeks, but now you're going earlier than what I was told. But
I found out about 3 weeks ago when it was finalized. Yeah,
okay. So what's the date you're leaving? The third,
March 4th and come
March
back
the
April 10th.
4th and back April 10th. Yeah.
Yeah, but my team's down there, and heck,
I
you'd be
know that's a long way to go for me, and I love your team, but I want to go when you're there too.
okay. I
Like I
just
know
got a
you're not
bad.
there every day, and I'm fine
Yeah.
with Dr. Blanco and Dr. George, like very fine with them, or else I'd follow you back and forth like Patrick did. But I don't like
I do become a taxi now and then.
yeah. But yeah, so I hope that people will come. I had a group with over 1,000 people in it interested in that clinic, and then Facebook, they keep doing that to me. So
Cool.
now I have a newer group and there's about 350 or 400 now. I forget. But it's hard. Facebook makes it really hard, and I want people to join Telegram. I have a clinic group on Telegram where we can actually speak openly and say what we want, and I can post what I want without Facebook wanting me to authenticize my, they want me to send them my driver's license and all that kind of stuff. And right now I'm working on an account that isn't mine, and I can't if they want, so I have to lay low. I can't even post now. I have Christine posting for me. I have people doing my stuff, so I have to lay low, or Facebook is going to boot me again. I didn't even do anything. It was just Facebook stuff. It was
Hmm.
just a big mistake. Nothing that I
I'm
really did. I've been
sister, I'm with
behaving,
you. Yeah, when you
but
start to get deleted and censored and everything else, you're on the right track.
yeah.
It's like the California board's going after me for a bunch of stuff. But like one of the videos, I had a dad that came from the Dominican Republic with a vaccinated injured kid, and the kid went into seizures, and I demonstrated on, during the interview on how to do it. And they said I should have put a disclaimer. Then I talk about reversing arthritis. Heck, in April, I spoke for 3 hours to the Idaho Association of Chiropractic Physicians, 3 hours on how to reverse arthritis. And in
Hmm.
California, they said I can't say that.
Yeah. Well,
Okay.
you're getting in trouble for things you said. This for me, this is just stupid stuff, phishing emails and people reporting me for just because they don't like me, kind
Hey,
of thing.
darling, if we were in the UK, you put a meme on and you can get arrested.
Yeah, yeah. So I'm trying to get away from Facebook a little bit more, but people are stuck to Facebook. I'm trying to get them to come to Telegram and that so we can plan this trip. I want to have Zoom meetings with these people and plan on sharing Airbnbs and everything. So I see the time. It's time. Your time is pretty much up, right? So you
Hmm.
don't want to talk about, we can
Yep.
talk about the blood pressure one and that next time.
Oh, well, blood pressure. Um, if you want to just like a couple of minutes on it, because it's really, really important.
Yeah, do you see that? She's got 165 over 98. She says she can bring it down to 140 if with deep breathing, but she's on drugs for it, I think. Yeah.
Okay, so when I wrote the book, and this is probably like 8, 10 years ago, on how to correct high blood pressure, I went to a relative of my wife who's been a medical doctor for 35 years. And since the body, human being, is self healing and self regulating, that means you regulate yourself. Okay. And every human being is responding correctly based on the stimulus. And we have this automatic nervous system: stress, sympathetic; regeneration, parasympathetic. And when you're in a sympathetic dominant or a stress state, the blood pressure has to elevate in order for you to adapt. This is
Mhm.
why if we were watching a scary movie, and I don't like scary movies, my blood pressure would go up. Okay. So I asked this doctor, I said, have you ever checked anyone for a sympathetic dominant state? And he looked at me and said, we know the cause of high blood pressure. It's idiopathic. And I thought he was bullshitting me because idiopathic means unknown. We
Yeah.
know the cause, it's unknown. And so one of the things, checking your blood pressure incorrectly. So I have to walk people through this. If you run up, had 4 shots of espresso and run up and down stairs, does your blood pressure stay the same or go up?
So,
Okay. Okay. Angie, you have a great deal of common sense. And can you imagine asking someone and they'll say, well, I just don't know. You know, that's about half of the time. And I said, okay, if you stub your toe, does your blood pressure go up? I don't know. I'm not a doctor. Okay, I'm going to get a hammer and crush your toe. Would that make you in a relaxed state or a stress state? So you got to walk people through it. And to say, what is a normal blood pressure? Well, there's a joint national committee that meets every 10 years about, okay, in America. And in 1994, they said everyone should be 120 over 80. Everybody. That means the 12-year-old gymnast, the 400-pound cigar store owner, they all should have the same blood pressure. And if not, we can give them a beta blocker, diuretic, or ACE inhibitor to lower it. Then that was changed in 2004 to 115 over 75. So everybody that was normal is now high blood pressure. Then that was changed in 2014 to 150 over 90 if you're over 60, and then they had 130 over 80 if you're diabetic. They had a bunch of different ones. Now, in 2017, the American College of Cardiology broke from that pack and said, we have no data to support it. We just feel 130 over 80. So this is all foolishness. Okay, your body is regulating itself. So what you want to do is look at the pulse pressure, not this high number and the low number, the difference between the two. And
mhm.
even this is not lack of medication. Okay, 40 to 60 is normal. The older you get, 40 to 70 would be normal. Okay, so like 160 over 100 would be a difference of 60. So that would be considered a normal. Okay, a normal, because we're looking at the efficiency of the blood and not the number, because that changes all the time. See, there's
Mhm.
nothing broken in your body that causes the body to not regulate itself. Now, in Angie, when we look at blood, if the person's in stress, the beautiful red blood cells start to overlap or start to stack. If the
Yeah.
blood's stacked, it's not efficient. It can't hold oxygen. So, what has to happen? The blood pressure, if you have a stress state, it has to go up. And this
Yeah.
is why I say, did you check the blood pressure of your dog? And they'll look at me like I've grown a third eye and say, well, no, I'm not going to check my dog. My dog can regulate itself. Okay. Have you checked the blood pressure of your cat? Well, no, my cat can regulate itself. Oh, but you can't. So your doctor is smarter than your own physiology. These are all foolishness. 50 years from now, the doctors are going to be measuring blood, because blood pressure, to be diagnosed high, it has to be taken at 3 different times of the day over 3 different occasions over a 2 week span.
Mhm.
And because the drugs that lower the blood pressure are so damaging to the other structures, because your brain burns 90% of the body's oxygen and it only weighs 2 pounds. So if you take a drug to slower your blood pressure, does that help oxygen in the brain or slow it down?
Mhm.
I know I
Right.
got to say it that way because people say, well, I don't know. Okay, yeah. So look at respirate $400 machine that I don't recommend anybody get. Okay. But look at the technology behind it. You literally listen to a tune, breathe in and breathe in through the nose, out through the mouth, into a tune, whoo, exhale out through a tune. So if you deep breathe diaphragmatically for 15 minutes, it lowers your blood pressure all day long if you're concerned with high or low. But it's the blood pressure is not a lack of medications. It's a sign of stress and you're taking it incorrectly. You have to
Right.
deep breathe diaphragmatically 15 minutes before you check it, and then you're going to get some kind of reading.
If you have to go this second, you can, but I have one really important question.
Oh, what's a real important question?
Well, Liz just showed up and she's planning on hopefully coming to the clinic with me. And she just had x-rays and MRIs and whatever. And the medical doctor said, how did you get these fractures? Because I don't know. I don't have fractures. Because she got really nasty and basically said, well, yeah, you do. Don't ever tell me you don't because you do. And she's freaking out because she's has no idea why she has these fractures showing up on the x-ray. And I told her, because I know from being to different types of doctors and even different chiropractors that it's an interpretation, these x-rays, because different doctors will say different things about the same damn x-rays,
Hmm. Oh, it's
right?
true. Yeah, I mean, we'll see a whole bunch of old fractures, and this is typically at the junction of the rib cage and low back. And I'll say, "Wow, you were jumping off of some roofs," and I'm talking to like a 60 or 70-year-old person, and they'll say, "No, doc, it was some hay bales." you know but yeah, you'll see old traumas and fractures, like if there's a shifting of a vertebrae. It's called an anterior listhesis. That means they broke a part of the vertebrae too. Yeah, it's no big deal.
So
I
they
mean,
do it, but they can have fractures and not even realize it.
oh heck yeah, yeah, but
Wow,
the body adapts to it.
that's
you know
amazing because she was that really freaked her out. She's been really upset and stressed over it, and the doctor was really mean to her about it too, just because
yeah,
she
yeah,
wasn't aware.
doctors particularly, oh my God. If you question a doctor, okay, or if you ask them weird questions like, why, doctor, what caused it?
Oh, I know.
That's a world that you don't want to go into. That's dangerous.
Especially surgeons, they're the worst because at my
Yep.
knee, but the surgeon in Mexico was the nicest guy ever, but the one here, oh, when he found out I was in Mexico getting surgery, that just set him off. He told me it
Yep.
was the worst thing I could have done, and they did it all wrong and everything else. Yeah, I
Oh
like them.
God. God bless you, dear. You're amazing.
Okay. You're amazing, and thank you so much for coming, and I hope we can do this again
God
sometime
dang it,
soon.
I missed it.
Oh yeah.
Oh,
Oh no,
somebody.
it'll be recorded, and I'm sure Angie's going to put it on somewhere.
Yeah. Yeah, I'll be definitely doing that. I hope that it recorded. It says it's recording, but it doesn't mean it's recording to my computer necessarily, does it? I think it does
Darling,
because I can pause recording and stop recording. So yeah,
yeah,
I
yeah.
have it probably like, and if I don't, I can
And if
always get
if
it from
not,
you.
darling, I'm gonna put it on there. And we've got, if anybody wants to get a hold of me, we have the DRB VIP site, Dr. B VIP.
Mm-hmm.
We also have the adaptivephysiology.com, which has so much information. The goal of that site is to literally teach people how their body works so they don't need some healthcare professional. I mean, I want to turn moms to know how to help kids, or spouses to help each other if they have a headache or joint pain or cough or cold. All this stuff will be taught in schools in another 100 years. Okay, because people are going to learn that their body is brilliant. There is a divine energy, and how to help that body adapt and thrive. And all that's on the adaptivephysiology.com and the DRB VIP site. We've got tons of stuff on there.
Yeah, you do. I'm on that one. I haven't been on the other one much. Is there a membership fee on the adaptive one?
I think you can sign up for a free course, and I think here, let me look it up. There's actually a code. Um, Here, let me find the code. That way, all your peeps can get on there. Oh, yeah. Okay. Use the code New Year, all caps with no space between the new and the year. And then
Mm-hmm.
you get 50% off, but you can sign up for a free course.
Okay, and that's for the adaptive.
Physiology.com.
Okay,
And that's
okay.
got, I mean, everything. It's to all the deleted videos, all that, and then we've got that new series on the DRB VIP site, Dr. B VIP, and that's the forbidden stuff that you really can't say.
What on the Dr. VIP?
Yeah, yeah, yeah. That's
Yeah.
that's just like you and me talking,
Hmm.
and but it's
Okay.
dangerous subjects.
Yeah. Yeah, it's definitely good and people should join that. And it's only what, $40 a year or something?
Yeah, yeah. I think it's like $3 a month.
Yeah. So there's no reason not to join. I mean, everybody, if I joined every place, every website that I'd like to join, it would cost a lot. But yours is the fee is more than well worth it, and who can afford $40 a year? Well, everybody join. That's where the best info is because you've had a lot of YouTube videos deleted, right?
About 600 of them. Yeah, because if we talk about bowel disorders and we talk about an inflammatory response from some type of injection, like, oh, I don't know, a flu
Oh,
shot
we
or
don't
something.
talk about that.
Yeah, yeah, no, no, I've been, but that's why we were deleted, demonetized, deplatformed. They've tried to do a bunch of nasty stuff.
But you're still on there now at least. But I
Yeah,
noticed that you search some topics and you can only find like videos that are 10 years old. But I know you have newer ones on those topics, but they seem to leave your older ones alone.
yep,
They have the
yep,
good information too.
yep, yep.
Hmm. Well, thank you, Dr. B, for showing up, and I hope we can do this again. Are we going to do it again?
Heck yes, heck yes.
Cool. Okay.
Anytime, darling. And thank
Okay.
you so much. You're changing the world by getting this information out. God bless you, my dear. And I'm going to give you the biggest hug when I see you.
Oh, I can't wait. Thank you.
Have
God
a great
bless you.
God